We are live today from Sakra World Hospital, Bangalore. We have with us our expert Dr. Surender K. Yachha, a Director, Pediatric Gastroenterology, Hepatology and Liver Transplantation to discuss all your queries on abdominal pain in children. Good afternoon, sir.
Good afternoon.
Welcome to our live show.
Thank you very much, and welcome to all the viewers who are right now seeing your program.
Okay, sir. Doctor, here are a few questions from our viewers. What is this entity? What is the presentation?
So I shall be discussing about the abdominal pain in children. A problem which is usually seen in outpatients in our hospital and elsewhere in the country, and the common problem. This entity is basically nothing but a disorder which is in a basket. Basket in the sense that we have three segments in the tummy: upper segment, the middle segment, and the lower segment. The upper segment is different, the disorders are different as compared to the middle segment, and disorders are different as compared to the lower segment when we see the central abdominal segment. Mostly I will be talking on the central abdominal segment, which is usually called recurrent abdominal pain in children. This occurs in children in the age group of 4 to 14 years. Around 30% of children all over the world are suffering from this condition. Now, the presentation of this condition, generally what we see, there's a lot of pain in abdomen, lot of conditions. But this condition, which is lasting for more than 2 months and more than 4 episodes of pain in abdomen per month, that means 8 times in 2 months' time, when it occurs repeatedly and intervening periods are normal, that is called the functional abdominal pain or recurrent abdominal pain. Generally, these children are healthy, but they have this pain which affects their quality of life. Mothers, parents, they're all worried. Children have the affection of the quality of life, and they come to seek the doctor after doctor and doctor after doctor, investigation after investigation, but no relief many a times. The reason for that I will be enumerating in a short while from now, and that is the presentation of these children.
Okay, sir. My next question is how it is diagnosed?
This condition is basically a diagnosis of exclusion. See, there is no diagnostic test single which can say this is the recurrent abdominal pain. It's actually a combination of many things which we see in the child. Now, when a child will come with recurrent abdominal pain, as per the definition, if he fulfills, then we see the following things. We look at the child, take a thorough clinical history, and examine the child. It is not that just on saying or like video conferencing we can do, we cannot assess the child properly. Unless he comes to us and sees, we'll see the child in person. Examination is normal in these children. They have only pain abdomen. They may have sometimes headache or some limb pain and some change in the appetite. But all the examination, thorough examination, physical examination, no organomegaly, no hepatomegaly, no splenomegaly, I mean to say liver, spleen are normal, kidney is normal, chest normal, everything normal. So once we label that the child doesn't have any other problem excepting abdominal pain, this is our suspicion, strong suspicion that this is coming as a recurrent abdominal pain. So in a nutshell, you will not see any abnormality in the child except in this pain abdomen. There are situations when child will have constipation, not passing stool, will have decreased appetite, will have limb pain, will have headache, but that is not a primary problem, it's a major problem. The problem major is actually the pain abdomen. Rather, things are associated features with this condition. We have no tool to confirm the diagnosis of this condition. So we always look at the clinical condition of the child and label as a recurrent abdominal pain. But very importantly, we look at stressors. Stressors mean there's a baseline abdominal pain in children, but they have something which aggravates, which increases, which becomes a precipitating factor in them to have pain abdomen. And there are multiple factors which we try to dig out that information from the parents, from the child, maybe independently or jointly, but best is when we interview them separately. Then they can divulge the things properly in a private manner. That is the art which I will tell you about the counseling. So stressors have to be identified. Now people ask me, what is a stressor? What are these? There are many stressors. There may be children are going through a very harsh environment at times. They are going through the schooling. They are in this home, and they have also the personality problems. Say like stressors, home. You have changed the residence and gone to some other place. You have lost the friends. You have lost the association. That might become a precipitating factor. Or you have got what is called you are sent to a coaching, too much of coaching. That becomes a stressor for them. There's a SIP death in the family. There's some SIP rivalry is there at times. Or there may be actually conflict of the parents. There may be a lot of conflicts which can affect the child. So parents should realize that there may be some triggering factors for which they may be themselves responsible. I don't hold them responsible, but they may be responsible. So they can become the precipitating factors. In school, a lot of precipitating factors are there, like high academic achievement. There are academic pressures. They are having board exams. And there is actually some kind of what's called bullying by others. Or by the teacher abuse. So these become some of the factors which are actually precipitating factors of functional abdominal pain. They are not the causes, but they precipitate the abdominal pain in the children.
What are the tests done?
Tests we don't see. A lot of it when we see at Sakra, there might be final destination. To a senior person like me, they say, sir, you are very senior, a lot of experience of more than 35 years in this field, exclusive pediatric gastroenterology. So we have come with a big hope to you. So when I see a bundle of papers with them, number of investigations done, ultrasonography done, and to my mind, the best experience of these years has taught me only that fact that too little investigation is required. Don't go for all one, because there's always a fishing expedition. This is called fishing expedition. When you do investigation after investigation after investigation, you will not get any results from that. Because it's a functional disease. It is not a structural problem, it's not an organic problem where you can find. For instance, I find a stone in the gallbladder. I find a stone somewhere else. So in the kidneys, that's the organic. This is functional, why you will not see anything happening on the investigation. So therefore diagnosis is mainly the tests which are mainly done, maybe a routine blood test, CBC what we call. You may do a routine urine examination, and depending upon what is your suspicion, then you may do some selective tests in them. Otherwise, I don't do. I believe in not doing too many investigations on children, because they are very, very, we should say, fragile, in the sense that they don't like pricks. They don't like any kind of intervention. So we have to be very gentle with them. So I don't do much of testing in them. So that is how we basically the clinical diagnosis. by exclusion.
Okay, sir. How is this entity managed?
Management is the main question. So the patient will come to you with the hope that you will do something for them, for the child. So I would also add in the testing, see many children come with an ultrasound, invariably 99% they come with an ultrasonography of abdomen, and they say to me, sir, there is something, you see with this line we have underlined, there is a lymph nodes in the abdomen, there is lymphadenopathy, what has been commented by the doctors. Normally when you see children, you do ultrasonography in population of the abdomen, majority, normal children will have lymphadenopathy. So don't bother yourself when you see an ultrasonography, which is sometimes done by the doctors, and they are not, mesenteric lymph nodes are there. Mesenteric lymph nodes are not at all alarming in this ultrasonography. But we look at the size of those nodes, we look at different other characteristics which may be important. So by and large they are not there. So don't worry, mothers, parents, sir, there is a lymphadenopathy in the ultrasonography. We got another done, that also showed this thing. So don't get worried about that. There's no need to do what I call the fishing expedition on these children. Regarding the management, see, the major cornerstone of treatment of this condition is basically counseling. Counseling of parents, counseling of the child if he can understand or she can understand. And what do we say? This is the art which the doctors have to learn to convey to the parents, and that should become convincing for them. We tell the pain is real in the child. It is not that child is just telling you. They say sometimes you go to school, then he gets pain. You go to exam, he gets pain, sir. So there is something, sir. But actually, the pain is real. They are not just telling you lie. They are not lying. It's a real pain. That should be told to the parents. Number two, we have to give reassurance. Reassurance in the sense that this pain is not organic. Organic means it is not a condition which will produce a havoc in the child. It is not dangerous at all. Very important. It will not create any problem. It will not progress. This pain may last for some time. It will remain for minutes, maybe sometimes half an hour, maximum it may last. It never wakes up the child during the night. Never wakes up the child. If there's a nocturnal, when the child is asleep and gets up from the pain, that is not functional pain. That should be very important. So the child is comfortable during the night. Now only daytime this pain happens. So you have to tell them that this pain is not going to be dangerous. It is not going to produce any disorders. And in around 30 to 70% of these children in the world, in various studies, we have shown that they get remission. Remission means they become free of this pain over the period of time. So don't worry, it is a question of only patience. Patience and faith in the deliberation which the doctor tells them, with the deliberation he makes with the parents. That is important. So other important thing in counseling is to identify the stressors, which I mentioned earlier. See, there is a coaching class going on, a lot of stress on the child. When you interview them separately, when you first joint interview, I do with the parents first, and then I will ask parents to generally go out and the child will stay back. Or He will come in a fresh and we talk to them. And that time the child may tell you few things which are important. They may not say in presence of the parents. So you come to know is there any stressor? How is your school going on? How is your teacher going on? How is your friends? How is your family? Do you have any problem with the family? Are you being loud? So all these things I will tell you an example here. I had one child who was actually put in a boarding school, and he told me confidentially that, sir, I don't want to be in the boarding, my parents are forcing me to do. So it was a precipitating factor for them. And I told parents very softly that you please bring him home. He feels separation of the parents, so he wants family. You please change it. And once they changed, they came after 6 months, they said, yes sir, everything is settled. So there are a lot of stressors, the deaths in the family. You have to reassure, you have to just give sort of confidence that this will go. So that is how we manage this condition. Important is counseling, important is finding the stressors and trying to eliminate them. And there is also drug treatment. There are multiple drugs which have been tried. You will see a lot of doctors writing, which is right or so. But none of the drug has been found to be very superior or very good in managing this condition. We have done a trial in 2022 in children, and nearly 140 children with recurrent abdominal pain, where we tried to give one drug which is called amitriptyline, which is a simple drug, very, very cheap drug also. And giving this drug, we found that if it is given for 3 months to 6 months, it makes a lot of difference. The response rate was 89%. And it was a placebo control, that means it was a controlled trial. And it showed a very good effect in these children. And that is the kind of drug we may be using at times, but you have to use selectively in certain situations, not necessarily in all patients. This is how we treat this condition, reassurance, and not doing too many tests.
What is the outcome?
Outcome is very good. See, don't get worried. And it is a severe pain, it is increasing in intensity, then you should seek doctor's attention again, go tell about this. Maybe that there is something more which is evolved over a period of time that can be looked at. Otherwise, the outcome is very good. As I mentioned, they go into remission. 30 to 70% of these children will go into remission. However, a proportion of them may develop what is called the irritable bowel syndrome later in life. So that is what is the status as of now today, abdominal pain in children function.
My last question is, any role of dietary restrictions?
See, these mothers come with they do their Google search these days, and they will come with a lot of their own thought process, and plus the literature which they gather from these sites. They'll stop milk, they'll stop wheat, they'll say this thing happened, this thing happened, this thing happened. But actually nobody knows. What is the reason? This is basically a problem of the gut, small intestine, that makes this pain to happen. We also tell them, I forgot to tell you that, we tell them that your child has got hyperalgesia, hypersensitivity. Hypersensitivity means if you pinch somebody, lighter pinch feels pain. If some patients may have actually deep pinch, then they feel pain. So with the lighter pinch, the pain is perceived. That is what's called the hypersensitivity, hyperalgesia which these children have. Now regarding the diet, very important, all people accuse this milk. Milk is bad, milk produces this, even a lot of medical people also tell them. But remember, milk is a very rich source of calcium. And children are growing, they are developing. Their bone growth takes place in this period. They are not like adults. They are static. They have achieved. They have to grow. Weight has to increase, height has to increase. Height will only increase, the bone length increases. And bone will only grow when there is calcium. So milk should not be unnecessarily restricted unless told by a qualified medical doctor. You should then stop. Otherwise, don't do your own theory. I've seen a lot of people resting milk and yet the pain is going on. And thereafter that I tell them, you please stop. Give curd, very good, important source. But some people may have intolerance. Not allergy, but intolerance may be there. In this age group, we don't find much of allergy because of the milk. It is intolerance which may occur. That's the difference. They have diarrhea as an episode. Mostly they have diarrhea. So don't stop milk, wheat products unnecessarily. Wheat, because they eat somewhere here and there, wheat produces. Wheat is a very important staple diet, particularly north and also in south now. There is a mixing of the population. Everybody is eating wheat. So it is difficult to withdraw wheat, and that too in a child. You have to be another important thing which I want to tell, that is regarding the junk food. Don't take junk food. I would advise that, not for abdominal pain, but for otherwise also. Junk food produces tremendous problem in the health, all the diseases. Any food that is frozen, that is stored, that is packeted, has an adverse effect on the child's health. Adults also. Therefore, that should be restricted, that should be taken maybe sometime, but I would say no to that. Cross to sweetened drinks, too many chocolates, or additives, some protein supplements. Take natural food. Nature has provided a very good combination of food items which fulfill the needs of the health.
Thank you, sir. So with this, we come to an end of today's live show. Thank you, doctor, for your valuable insights. Thank you, viewers, for joining us. If you have any queries, you can leave a comment and our expert will answer them for you. Thanks for your diet suggestion also, sir. Thank you so much.
Thank you very much. Thanks.